Hello, my name is David James Smith, MD. I'm the Medical Director of San Diego Comprehensive Pain Management Center and Pacific Surgical Institute, a fully licensed and accredited ambulatory surgical center here in Metro San Diego. We also have locations in El Centro, California and Chula Vista. I'm double board certified in physical medicine and rehabilitation and pain medicine with an emphasis on interventional pain medicine. I've been in practice now over 28 years, and we provide outpatient interventions to treat chronic pain. Some of the advances in the last 8 to 10 years have revolutionized the treatment of chronic pain and spinal disorders. Previously, many of these disorders had to be treated with hospitalizations and required months of rehabilitation. Current advances allow us now to treat these same conditions with outpatient procedures. This allows you to return to function quickly and to get out of pain faster. I hope you enjoyed this digital video library that we have created that shows some of the more exciting advances in interventional pain medicine. You can also visit us at SanDiegoPainCenter.com. Once again, I hope you enjoy these videos, and please feel free to contact us and check us out on social media as well. Thank you. This procedure is called radiofrequency neurolysis, and it's done after medial branch blocks. If the medial branch blocks are successful in temporarily removing the pain, then we go to a permanent fix or semi-permanent fix called a radiofrequency neurolysis. So we're marking 3 levels where we want to burn the nerve, and radiofrequency neurolysis uses radiofrequency waves to create heat and to burn a small sensory nerve that has no function primarily except to transmit pain fibers to the brain and pain impulses to the brain, causing patients to be very uncomfortable. So I'm marking 3 levels on the patient's left side, and most practitioners will do 3 or 4 levels. Now I'm anesthetizing each level with a little bit of lidocaine, 1% lidocaine. And you can see that stings a little bit. And then I'm going to do that a little bit deeper. So now the patient doesn't feel anything as I advance my needles. The needles sit on the transverse process, the superior medial aspect of the transverse process. And once I have a good placement, we put this little probe into the needle and we stimulate what's called a sensory and a motor. And that confirms that we are not near a nerve that is important to the patient that could cause some side effects. So we do our testing at each level, and then we go ahead and use the automated machine that will heat the nerve to 80 degrees Celsius for 90 seconds and effectively remove that nerve. The burn area, as I like to call it, is an area of several millimeters around the tip of this radiofrequency probe. So if you're not exactly on the nerve, the burn area being a little bit bigger helps guarantee that you've been able to ablate or burn that nerve. And although it sounds terrible, the patients don't feel anything because we numb them, and it's completely painless. And the effects are realized within 2 to 3 days. Most of the patient's back pain and pain in the buttocks, the back of the leg, down to the back of the thigh to the knee is usually resolved. So all 3 needles are being placed simultaneously. And now I'm using 2% lidocaine to numb each level before I start the burn, and this prevents the patient from having any pain whatsoever. So we're putting that nerve to sleep with 2% lidocaine. That is essentially the entire procedure, because once the probes are replaced, I have now used that 2% lidocaine to numb the skin. The patient doesn't feel anything for the 90 seconds that it's heated at 80 degrees Celsius. There's absolutely no pain. After the needles are placed and it's numbed, we take a final picture to make sure that the tip of the needle hasn't moved and that the spread of the needle to the probe captures the greatest surface area. And so you'll see me sometimes turning that, and that's the procedure. We are all done. And as you can see, the patient did not feel any discomfort. And there's the needle placement at the L4 in the sacral ala on the left side. I'm sorry, L5 in the sacral.